Hello everyone, welcome back to my YouTube channel Nursing Education. Today I'm going to explain about the part A of the CBT examination. So basically part 1 of the test of competency is computer based test, which is known as CBT. The CBT is split into the two parts. Part A covers the numeracy, whereas the part B covers the clinical questions for the midwifery. So timing for the part A examination is 30 minutes, which contain the 15 questions. Question number 1 is, what is the volume that has been drawn up into the students? Please use the correct unit and write your answer to 1 decimal. So 1 decimal means there should be one number after the point. So answer should be like 1.2, 1.3, 1.4. That's a 1 decimal number. So when you answer this question, you just have to be a little bit careful. So in this series, the liquid is only up to 9.5 ml. You might get confused with the seal of the plunger. So obviously there will be different color in the syringe, but just be careful when you answer in the exam, because in the examination will be different. You'll be nervous or something like that. Answer is 9.5 ml. 9.5 is 1 decimal number. There is one number after the point. There should be a space between the number and the ml. If you miss the space, your answer will be wrong. For the unit, M should be small and L should be capital. If you put M capital, your answer will be wrong. If the L will be small, then your answer will be wrong. So this thing you have to keep in mind when you answer this type of question. Question number 2, what is the volume that has been dispensed? Please use the correct unit and write your answer as a whole number. So in the container there is a liquid, and the question is asking to answer in the whole number, which means that the answer should not contain any point. So the whole number is like a 5, 10, 15, 20. Correct answer for this question is 10 ml. There should be a space between the 10 and then ml. M should be small and the L should be capital. When you answer this type of question, you might get confused with the liquid in the cup. So a liquid is only till 10 ml. As it is a cup, the liquid look like it is 20 point something. So that thing you have to keep in mind. And also you have to be careful with the question. This only saying, the question is saying only answer in the whole number, not a point. So when you read a question clearly and then you get idea of the answer, that make it easy to answer the question. So the correct answer is 10 ml. Question number 3, a baby weighs 3,450 gram at birth. Convert this weight to the kilogram. So this is simple. You just have to divide with the 1,000 to make the kilogram. So the correct answer is 3.45 kilogram. Question number 4, the formula for calculating infant feeds is volume of formula per feed equal to weight in kg into ml per kg per day. Divide by number of feeds in 24 hours. You have the following information on the neonatal feed chart. Ml per kg is 40 ml per kg. Weight of neonatal is 1.5 kg. Feed regime is 2 hourly intervals. What is the number of ml per kg? So we have to find out what is the number of ml per feed. So they have given the formula. You just have to feed number in the formula and you will get answer. Weight in the kg. The weight of the neonatal is 1.5 kg. 1.5 kg. Ml per kg per day is 40 ml per kg. So 40 will come here. And the number of feed in 24 hours. So baby feed regime is 2 hourly intervals. So total feed will be the 12. So if you calculate all these, your answer will be 5 ml. Question number 5. A baby weight is 4,100 gram at birth. On day thought the baby has lost 10% from the birth weight. What is the weight of the baby? Give your answer in kg to 2 decimal places. So 2 decimal means after the point there should be 2 number. To answer this question, you have to use a calculator. In the calculator, type 4100 minus 10%, you'll get answer 3690. Answer will be in the grams, so you have to convert it into the kg. To convert, you have to divide with the 1000, and your answer would be 3.69 kg. You will have calculator in your examination in the computer screen in the left side or left corner of the computer. Question number 6. Convert 500 milligrams to grams. Please use the correct unit and write your answer to 1 decimal place. See, again this question is saying to write answer in the 1 decimal place, which means that there should be 1 number after the point. To convert milligram into the gram, you have to divide with the 1000. Also, to answer this question, you have to divide 500 milligram with the 1000 and your answer would be 0.5 gram. When you write an answer, you have to give one space after the number, and when you write unit, the grams would be only g, a small g. If you write gm, your answer will be wrong, so only a small g, no capital, nothing. Question number 7 is: a woman has been prescribed 30 mg of prednisolone. How many tablets should be administered? So this is simple. You just have to see the box of the medication. So prednisolone come in the 5 mg tablet. You just have to divide the prescribed medication with the medication what come in the box. So 30 mg divide by 5 mg and you will get your answer. When you divide 30 mg with the 5 mg, your answer will be 6 tablets. So 6 tablets should be administered if the prescription of medication is 30 mg. Question number 8 is: a woman is prescribed budesonide 1000 micrograms by nebulizer. The medication is available as 500 micrograms per 1 ml ampoules. How many ampoules are required? To answer this question, you can use this formula. To answer most of the drug calculation question, you can use this formula. Even with the previous questions, that make you easy to answer the drug calculation question. So it's saying what you need. So woman is prescribed budesonide 1000 micrograms. So we need 1000 microgram of medication. What you have, the medication is available as a 500 microgram. So what we have is 500 microgram. Into what volume of solution it's in? So we have 1 ml of the solution per ampoule. So we have to answer the question how many ampoules are required. So if you calculate these numbers, you'll get your answer. So answer would be 2 ampoules. Question number 9. A woman is admitted to a mental health unit for a period of treatment. She is prescribed 100 micrograms of levothyroxine sodium daily. The stock dose is 25 micrograms. A stock of 200 tablets is supplied to the unit at the beginning of the woman's stay. The woman remains on the unit for 28 days in total. How many of the tablets should be left in the stock bottle at the end of this period? To answer this question, you have to read question carefully and understand it first. Let me explain you in a simple way. So the question is saying the prescription of medication to the woman is 100 microgram of the levothyroxine daily. The available medication in the stock is 25 microgram. So dose prescribed is 100 microgram. And dose in a stock is 25 microgram. So total tablet you have to give to the woman per day is 4 tablet. So that is the first question. It's saying the stock of 200 tablet is supplied at the beginning of woman's stay. So 200 tablet was supplied in the beginning of the woman's stay, and then tablet was 25 microgram. The woman remained on the unit 28 days. She was in the hospital for 28 days. So for the 28 days, she took every day 4 tablets. So total tablets she took in the 28 days is 112. Just have to multiply 4 into 28. So how many tablets should be left in the stock? So in the beginning, the tablet was supplied 200 tablets and patient used 112 tablets. So you have to minus 200 with the 112. So you'll get your answer 88 tablets. So after all the calculation, you'll get your answer 88 tablets. Question number 10. You have a prescription for 250 mg of pethidine. What volume should be drawn up for the injection? Please use the correct unit and write your answer as a whole number. So you have to use the correct unit. The question is what volume. When it's come the volume, your answer should be in the ml. The unit should be ml, and you have to answer in the whole number. So it's the answer should be like 10, 20, 50. There should not be any point in between the number. The medication comes in the 50 mg per 2 ml. You can use this formula: dose prescribed divided by dose in stock into a stock volume. So dose prescribed is 250 mg, dose in stock is 50 mg, and stock volume is 2 ml. So if you calculate 250 divided by 50 into 2 ml, you'll get your correct answer. After the calculation, you'll get your answer as a 10 ml. Question number 11. You have a prescription for 500,000 units of Nystatin. What volume should be administered? Please use the correct unit. Write your answer as a whole number. So question is asking in the volume how many ml of the Nystatin you have to administer to the patient, and the answer should be in a whole number, no point in the number. We have Nystatin with us is 100,000 units per ml. To solve this problem, you can use this formula: dose prescribed divided by dose in a stock into a stock volume. So dose prescribed is 500,000 unit. Dose in a stock or dose we have is 100,000 unit, and a stock volume is 1 ml. So if you calculate all this number, you'll get your answer 5 ml. Answer is 5 ml. One space after the number, and M should be a small, L should be capital. Question number 12. A woman is prescribed 500 mg of ampicillin every 12 hours. If the birthing unit's stock is 100 mg per tablet, how many tablets will she need for a 24-hour period? So question is saying a woman is prescribed 500 mg of ampicillin in every 12 hours. So dose prescribed is 500. The dose in a stock is 100 mg. So if the woman is receiving 500 mg of ampicillin every 12 hours, then we have to give 5 tablets to the woman in 12 hours, as we have only 100 mg of tablets. So question is asking how many tablets will she need for 24 hours. If she need 5 tablets in 24 hours, 5 tablets in 12 hours, then she need 10 tablets in 24 hours. So answer is 10 tablets. 10 tablets patient needs for a 24-hour period. Question number 13. A woman is prescribed 40 units of syntocinon in 500 ml of 0.9% saline post-delivery to reduce the risk of PPH. The birthing unit stock has 2 ml vials of 10 units per 2 ml. What volume of syntocinon will you need to add to the infusion? Please use the correct unit and write your answer as a whole number. So again, use this formula: dose prescribed by dose in a stock into a stock volume. Dose prescribed is 40 unit, dose in a stock is 10 unit, and a stock volume is 2 ml. So answer is 8 ml. Put a space after the number, and M should be a small, L should be capital. Question number 14 is, at what rate would you set the infusion pump to run? So you can see the prescription here. Date is today, route is IV, infusion fluid is blood, volume is 450 ml, and duration is 3 hours. Time start is at 8 hours. To calculate the rate, we need total volume and duration, these two. So total volume divided by time, total volume is 450 ml and time is 3 hours. If you divide these two, your answer will be 150 ml per hour. Question number 15. Complete the following fluid balance charts by calculating if the woman has gained or lost fluid over 24-hour period. If the woman has gained fluid, you should include plus before balance answer. Example 100 ml plus 100 ml. If the woman has lost fluid, you should include minus before your balance answer. Example minus 100 ml. Please use the correct unit and write your answer to one decimal place. So in exam, you'll get this kind of chart where you'll have input and output. So add all the input number and add again all the output number. Add all the number of input from the patient chart, and then your answer will be 1955 ml. Then add all the number of the output from the patient chart, answer will be 995 ml. Then subtract output from input, the final answer will be in plus 960 ml. M should be a small, L should be capital, and there should be one space after the number.